Hi guys, my name is Petra. I've been working with emergency services for 17 years, and I also train first aid. I'm here to answer your questions. Feel free to ask me anything.
What's the difference in the resuscitation process for a 6-year-old child compared to an adult?
There is a difference in the number of chest compressions and the technique. For an adult, as I've mentioned before, we compress the chest using both hands in the center. However, for a smaller child with a smaller chest, I can use just one hand. If the child is bigger or stronger, I can use both hands, but the depth of the compressions won't be as deep. For very small children, resuscitation must begin with 2 rescue breaths, but don't worry, the emergency operator will guide you through everything.
And what about someone who's 70 or 80 years old?
Of course, the differences can be significant. It could be a frail grandmother or still an active athlete, but the technique remains the same. For a frail grandmother, her chest may be more delicate, so we'll use less force. Don't worry if ribs break during resuscitation, it is unpleasant, but it's a normal part of effective resuscitation.
Could you show us step by step?
Sure. As I mentioned, it's important to expose the chest so we can see it. Find the center of the chest and place this part of your hand there. The head is tilted back, and don't forget to call emergency services. The operator will stay on the line with you throughout. Lean over the patient and start compressing the chest. For adults, it's 100 to 120 per minute. Don't be afraid to press firmly. It's a very demanding process, and even paramedics take turns every 2 minutes.